Thank you to everyone who joined us. My name is David Jordan. I'm the president and CEO of the United Methodist Health Ministry Fund. Thank you for joining today's webinar on Medicaid renewals. Today's webinar will cover the background on the Medicaid renewal process, as well as communication resources that are available. We will have a second webinar in 2 weeks that will really get into the nitty-gritty details about tips and tricks, and we'll hear from folks on the ground. So we're excited about this series and hope it adds to the field. First, I want to thank Community Care Network for co-sponsoring our event. Community Care Network of Kansas is doing great work in the Medicaid renewal space. They're being jointly funded by a number of our wonderful partners in the Kansas Grantmakers for Health, like Reach Healthcare Foundation, Kansas Health Foundation, Sunflower Foundation, and Health Forward Foundation, and Wyandotte Health Foundation. So we're excited to have them leading this work and partnering with the Kansas Department of Health and Environment. Also want to thank KDHE for their work as we navigate this complicated renewal process. As you know, this spring, like other states, Kansas resumed the Medicaid renewal process for the first time in 3 years. To prevent unnecessary coverage disenrollments, we are working to help educate partner organizations like you to spread the word on what we can do to help enrollees navigate this process. This webinar is aimed to provide background information and resources to you. We have two great speakers, Kate Gramlich from Community Care Network and Rachel Alexander from the Regional CMS Office. Now some quick housekeeping notes before we get started. Given the number of folks on this call, your lines are muted. However, we hope that you use the chat function to engage throughout the webinar. Right now, please introduce yourself in chat. We love to know who you are, where you work, and where you're sitting in Kansas right now, or nationally. Also, please ask any questions in the chat. We will be monitoring the chat throughout the webinar. We'll also pause to take questions after Kate's presentation and after Rachel's presentation. We will use the raised hand feature to call on folks. So please feel free to raise your hand. However, we encourage you to use the chat to ask questions throughout the presentation. We're looking forward to a robust discussion and ongoing partnership to reduce coverage loss in Kansas. With that, I'll turn things over to Kate, and she can take things away. Thank you again for joining us.
Thanks, David. Hello, everyone. So I am kind of browsing the chat to see where everyone's coming from. It looks like we've got a great variety of places, and keep them coming, because I always want to know where you all are in Kansas and kind of what you do, the work that you do, and who you're helping. So if I would be able to, let's see, I can share my screen. I'm going to kick you off there. All right. See a kind of a goldenrod color. Okay, great. So as David had said, the unwind is a nationwide kind of situation that we're in right now, where Medicaid renewals had been just continuously, they've been on pause during the COVID-19 pandemic. And so for 3 years, people did not have to do their annual renewals. They were just renewed automatically. And so because of nationwide policy, this has ended. And so each state is having to tackle the new return renewal process a little bit differently. So I'm just going to go through some brief, very 101 about that in general, and then we'll kind of talk about the Kansas Unwind Plan, what things look like here, and then some tips for assisting the folks that you work with, and then some action items and resources. And as David said, just ask questions anytime. I may not have the chat kind of in front of me while I'm on here, but hopefully someone will cut me off to ask a question. So again, so what we're facing now is each state has the huge task of manually going through and renewing each household that's on Medicaid. So in Kansas, that's called CanCare. Each state is doing it differently, you know, kind of based on their state's roster and things that are allowed within their state's plan. And this is a daunting process, kind of returning to the way it was before the pandemic. There are so many households, you know, that joined Medicaid and CHIP during the pandemic, and so they have never had to do the renewal process that had been happening years before. There's also folks who are had been on CanCare for years, but I don't remember anything pre-pandemic, it feels like. So I don't think I would really remember exactly what the renewal process was for my family. So we're trying to kind of reach folks who are both new to CanCare and who have been on it for years, just to refamiliarize themselves with what we're doing going forward every year for the households. So Kansas and other states released their plan to CMS in February of this year. And there's different kind of ways that different states are doing it, where they may, you know, look at the roster, kind of prioritize different populations or what have you. We're doing chronological order. And so they're typically kind of linked to when their initial renewal period was before the pandemic. You know, there's some variation, but it's not like alphabetical by last name or anything. So we want to just communicate that, you know, there's each household is going to be kind of going through this process to some extent. And it's going to be kind of based on their date, not, you know, factors of their household or last name or anything. The notices are sent by postal mail only. So for a lot of folks, you know, who moved during the pandemic once or twice or 10 times, they may not have kept CanCare updated on their exact address each time. So the notices are going to be sent to the address that CanCare has on file. This may work for some people, you know, for others like myself, I've moved during the last 3 years. They would not be able to reach me at my house if I had not updated my address. So that's going to be one of the ways that we're going to help folks with this process, is teaching them how to, like, helping them to update their address in a couple of different ways to make it a little bit easier on them, and make it so that the CanCare notice will actually reach them where they are. The first households, you know, if you are working with folks on CanCare, you likely know this, they receive notices in mid-March, which were due in mid-April, and then had received their coverage end notice and would have ended May 1st. There have been some flexibilities and some changes to this, but we want to continue with the messaging that households are going to be renewed each month, and they need to get their paperwork in by the deadline in order to avoid unnecessary loss of coverage. I'll kind of go through some tips and tricks on how to help folks with that process in just a moment. Some states are kind of trying to rush through their rosters within 6 months or something, or 6 to 9 months. And fortunately, Kansas is utilizing the full 12 months that's provided by CMS. So it's hopefully going to be alleviating some of the stress and some of the pain by using the full 12 months. We will have these slides available. I've got lots of resources that you're able to explore on here. One of the ones I wanted to point out, and this will be in English and in Spanish, is the renewal frequently asked questions. So I will go ahead and bring that up here. So CanCare has an FAQ on, you know, kind of what the unwinding is, what this timeline is. It gives some information like was shown on the PowerPoint. It also shows kind of how things work and the different types of renewals that people might receive. So we'll have this frequently asked questions available. It's also on the CanCare website. It gives some information and some background. So if you have questions, if your staff has questions, or the folks that you serve, these will kind of clear up some of the basics. One of the ones I wanted to point out was that as that timeline showed, you know, there are a lot of households being renewed in these first few months of the unwind, but it is continuing out for the full 12 months. So, if you're working with a family and they say, I haven't gotten my renewal letter, I'm worried about losing coverage. It is possible that it did get sent out, but it also is possible that their renewal month isn't until way later. So we'll get some tips and tricks on how to kind of alleviate some of that stress in just a moment. So I would highly recommend looking at this unwinding frequently asked questions. It does give some basic information on this whole process without it being too overwhelming. So we'll have a link to that. There's also the Spanish version. But we wanted to kind of show what you can do to help the populations that you work with, some tangible steps and some resources you can share or print or post on your social media. So the one thing that is very, very important to start is to make sure that folks have their address updated in CanCare correctly. This is probably something that's been preached to you many times. It is crucial though, because since the letters are coming in the mail, they need to be able to reach the people that they're trying to reach so that they don't lose coverage unnecessarily. CanCare has the clearinghouse number, which many are familiar with. It's also possible to call the Medicaid insurance provider, the MCO, to get the renewal dates that way. It may be that the consumer that you work with already has, called Aetna or what have you before, and so they're used to calling that number. If that's easier for them to do, to look up their renewal date that way, that is great. You're also, as someone who is helping that person, if you call with them to kind of alleviate some of that stress, that's also helpful. So you can call the clearinghouse, call the MCO, or the new feature that CanCare has created for this process is a chatbot that is on their website. So we've got a brief video, and if there's time later, I can kind of show that. I don't want to take up too much time right now, but I will show you where it is. So there's a video tutorial that again is linked on that slide, and you basically would click this chatbot in the corner, and then it'll walk you through a series of prompts to be able to update their address. The great thing about this is that you could do that from your work computer to help them. They can do it from their phone. They can do it, in the middle of the night or before second shift or whatever kind of is their life situation. They don't have to wait on the phone or call during office hours or anything like that. So the Kiera chat bot for updating the address is really, really helpful in the majority of cases. There will still be probably some cases where you'd have to call the MCO or call the clearinghouse, but starting with this Kiera chatbot is a great policy. The video again will kind of walk you through exactly what to do. It'll walk you through what the screens look like, what information you provide, and then it is updated. So that's something I highly, highly recommend that folks who are helping CanCare members, I recommend that they take a look at that and familiarize themselves and their staff with that chatbot. There's also, and I will provide a link to this as well, we've learned some things from KDHE during this process. This is a new process for everybody getting into the unwinding, and there's been pain points and lessons learned, and so we've compiled a list of tips and tricks for helping the folks that you're working with. That first one is going to be, to reiterate, it's only coming through postal mail. They're going to use the address they have on file. You've already heard this from me multiple times. Make sure the address is updated, and it gives the ways you can do that. Also talking about the process is going to be happening year round, and how to find out your renewal date, call the clearinghouse or call that Medicaid insurance provider again. One tip is that there is a voicemail option for the clearinghouse. So if you are unable to wait on hold or are not sure how long you'd be waiting, you can leave a voicemail to kind of cut down on repeat calls and long wait times. So there is a voicemail prompt, and we'd recommend utilizing that. One tip from that first point about postal mail is if you're working with folks who are currently without a home address, they are able to submit a friend or family member's address where they have access to checking their mail. So they would want to be an address where they can have communication with that person who lives there and be able to check the mail on a timely basis, because time is of the essence when they're doing these renewal forms. So we've got address, we've got voicemail option, and then the third kind of focus is once they receive their renewal information, it is really, really crucial for timeliness and for making sure that their coverage stays ongoing to return the renewal paperwork as soon as possible. This will kind of cut down on a lot of headache and heartache of, filling out a new application if they miss the deadline and the grace period or what have you. So we're really, really trying to help folks fill out their renewal paperwork as soon as possible. Some tips we've got are make sure that the paperwork is signed and dated. So this is something that I will mention a million times. Unsigned forms, no matter how perfect they are otherwise, won't count. So we are signing and dating our paperwork as soon as we can. Also, it's better to send in an incomplete but signed form as soon as possible, rather than waiting for all the perfect documentation and all the accurate data to send it in later. So if you send in an incomplete but signed form, they at least know that they've got the address rights. They know that you are aware of the situation. You kind of hold your place in line, so to speak, for CanCare to follow up on what they need next, whether it's proof of income or what have you. So sign that paperwork, send it in right away to avoid any kind of unnecessary loss or gap in coverage. And then also, there's postal delays nationwide, as we know, and things get lost in the mail, which we've probably all experienced. So faxing your paperwork to the CanCare clearinghouse is another great way to go for getting your information in and having a confirmation afterward. So in case there's any issues, you would have that confirmation paperwork of where you sent it from, who you sent it to, and the date to kind of have proof that you are on top of the process. If you are serving CanCare members and you have a fax line, if you're not already, I would highly recommend and encourage folks to allow use of fax services for free. If you are assisting folks with this process and you can keep a copy of that confirmation number on file in their file, that is so helpful, because we all lose paperwork, and it's really nice to have an advocate who's able to kind of have a handle on that as well. If you are not able to do fax services or don't provide them, there are public libraries and other locations in your community to recommend for free faxing. So this would be a huge, huge help. So with all of those tips and tricks, and we've got this in a printable form, these are ways that you can feel like you are making a difference and that you are helping folks go through this kind of confusing and possibly overwhelming process. So we've got a variety of resources that we can share. When we send this out, we send out the PowerPoint. There's going to be articles, a lot of information that you can look through. But one that I wanted to kind of show you is this Helper Network dashboard, and we'll go through some communication tools that are located there. So as David had mentioned, we are funded by Kansas Grantmakers in Health, and we are kind of assisting with spreading the awareness of this process throughout Kansas. And one of the ways we're doing that is having monthly calls where any of you are welcome to hop on the third Thursday of the month at 1 p.m. There's the registration link here. And you'll learn about, initiatives that are going on to prevent coverage loss. You'll learn updates directly from KDHE, and you're able to ask them questions directly, which is really, really powerful and helpful. We also send out newsletters. There's a variety of resources that we're trying to provide here. We've got that printable tip sheet, the Kiera how-to video. So a lot of these resources are going to be in one-stop shop on this dashboard. Wanted to kind of point out before I hand it over some social media toolkits and information that you can share with your members and your social media audiences. So KDHE has a robust toolkit that kind of goes over not only, oh, good, that's good. So their toolkit has a lot of English and Spanish resources. It has printable flyers and postcards. It's got sample letters that you could put out in your newsletter, or things that you can email to your patients and clients to kind of give them some accurate information on this process. It reiterates a lot of the stuff I've talked about with make sure you update your address and check your mail and act on that. But it kind of gives you that language so that you don't have to reinvent the wheel and write it yourself for your newsletters or for your communications. There's also, we have, so a lot of those resources are in English and in Spanish. We've also got a file here on this dashboard that gives the kind of phase 2 flyer about checking your mail and acting on what you receive. We've got it in 15 different languages. So if you are working with clients who are not English and not Spanish speaking, we've got various languages here that we've been able to provide thanks to those grant funds. And I am happy to have things translated into other languages if that's of interest to you. So you'll just be able to contact me and we can get that going. A lot of these were actually suggested by community partners and possibly people on this call who help folks who speak a variety of different languages and are wanting materials to effectively communicate. We also have another kind of a roundup of social media resources on here that's linked. We have English and Spanish Facebook posts, Instagram posts, stories, Twitters, we've got, or tweets, I guess they're called. We've got a lot of different resources to share, and some, like in the CanCare toolkit, some language that you can post as well. You can download the videos or the videos and images in English and Spanish and share them without having to, again, reinvent the wheel. I will be happy to answer any kind of questions over what we went over. I know that's a lot of information thrown at you in a very short period of time. So if you've got questions that haven't been addressed already in the chat, let me know.
Thank you, Kate. I think the question in the chat was related to, can folks update phone numbers in Kiera, or can they only update or online, or can they only update addresses? Great.
Yes. And Melanie was right that for updating address and phone number in Kiera. And when you get a chance to look at that video, it'll walk you through exactly what you do to update both of those things and kind of verify that, verify the identity and get that updated. So great question.
Yeah, I mean, folks have other questions, put them in the chat or just raise your hand. We can try to spot that as well. And I mean, so many of these questions are very like hands-on, on the ground, like about mail, about addresses, about process. So they may seem simple, but we may not be thinking about something, and then they may indicate bigger issues. So please, if there's challenges you've faced with helping re-enroll folks or supporting them through the process that you have questions about, or if there's things you want to elevate, now's the time to raise the hand. Sherry?
Yes. Hello.
Yes. Hi, how are you guys? I hope I'm going to say this correctly, so I'm just going to say it. So, because a lot of information has been thrown at me and I'm trying to just organize it. Okay. So I've been trying to get my consumers familiar with the self portal, because the pamphlet thing just really confuses them and stuff. So when I talk to them about that kind of stuff, I kind of just gear them to that, you know, especially if I see that they have a smartphone or whatever. Are we still using that process? Is unwind going to, like, how is that going to work? Is that two different things? Like, am I thinking different on this?
No, you are ahead of the game. So
Okay.
that's actually something that's a really great point, and something that we're working on some resources with KDHE to help with that. So let me go ahead and share my screen again and show where you can locate that. We've made it a little bit easier to find the self-service portal, and yeah, thank you so much for bringing this up. This is great. So this is basically, you know, it's as it says, it is a portal where you can be logged on online and access your details of your Medicaid case yourself on your own time. So this is great, again, for folks who, you know, are tech savvy or have a smartphone and are able to do this. It's also something that we can help patients and consumers walk through the creation for. So what we have learned, a very, very important piece of advice is to get your self-service portal set up before your renewal paperwork, if at all possible. So I know that's not going to help a lot of households who are already going through this, but if you talk to someone and their renewal period isn't until December, say, let's get you set up on the portal. And we'll be able to kind of make this whole process a lot smoother when it's your turn. So on the CanCare website, and we'll be adding hopefully kind of a little write-up of this to the dashboard. We're working with KDHE on that now. But you will be able to sign up for the portal. It'll be a sign up button up here. If you're on a cell phone, it's going to be like 3 dots in a row up in the corner. You'd sign up, and I walked through this process just the other day. It's going to ask you kind of, you know, the basics of, you know, who you are, setting a secure password and some security questions. Make sure you remember what those are, keep them in a secure place so that you can kind of access your portal easier later. And then when you set it up, it should prompt you to link your Medicaid case to your account. So if you sign up for the portal, type in your accurate address and everything, that's not going to connect with the CanCare system on its own, unfortunately. So you have to link your account, which is that kind of case number or Medicaid ID. It will walk you through the information you have to put on there to link your case. And then it's a manual process. So KDHE staff member will kind of verify and make that connection online so that the two things talk to each other. And then the member will receive an email or confirmation saying that they have it linked. It may take, since this is like a human being doing this process for each person, it may take a few days. You know, so I would say if you're sitting with someone, it's not going to be linked right then when you're sitting there with them. They may have to do a follow-up appointment, or, you know, you call them back and and make sure that it worked. But after that, they will be able to kind of see the details of their case. They can look through their renewal paperwork when it's ready and submit that online. So I think Sheree brought up a great point. That's going to be really helpful for people who are able to do that step.
Okay, so I hope I'm understanding. You're saying that we can set them up on the self portal so that they can self-manage that themselves.
Yes,
correct?
yeah. If you're with them, yeah.
Okay, yeah, I take them through that process. I thought it was something like you were saying, like I set up an account and then my active people will be underneath it or something like that. But that's not what you were saying.
No, it'll be individual that way. Yeah, that way they've got total control once. But make sure that you walk them through that account linking process.
Yes, I do. Yeah, I do.
That's kind of a hidden step that can be tricky for people. So yeah.
Yeah, I always make sure they write it somewhere.
Yeah.
Like in their phone, their user word, password, all that.
Good. Yeah.
Well, and just a piece of advice, if they are close to that deadline, don't go through that self portal because it will take too long for you to get that information. So we've went ahead and then done the written reapplication and faxed it on behalf of those patients to try to assist them.
That's great, thank you. So if you talk to somebody and, you know, you find out that their renewal month is in the future, then this is a great tool, or for future years. I mean, this is going to keep going on. So, but yeah, like Melanie said, that's a great point. Again, since it is a manual process to link the accounts and get everything in, it's not like a last minute situation. It would be more of a prepping ahead. All right, Caitlin.
Thank you so much. Regarding this same portal, is there, once everything is linked together, is there currently a way to show when their review is going to be due? Obviously, not right now, but if I help somebody get linked and set up on this, and then they say, oh, your renewal is coming up in November, is that something that's currently available, that date?
Actually, that is a great question. And I think we may have KDHE staff, if they'd be able to answer that in the chat, if that is a feature, or if anybody who has helped someone with that process, if they've seen the renewal date. That's a great question.
Thank you.
Hello, everybody. My name is Russell Nettler. I work with KDHE, and setting up and establishing an online portal will not give you the information of when your review month is. You would still have to ask your MCO or call the CanCare Clearinghouse. I'd also say back there where we showed you where to sign up for an online portal, there are also videos. If you chat on the handbooker in the upper left-hand corner, there'll be, I think, 8 or 9 videos that sort of help you sort of go through the process of establishing an online application or account.
Perfect. Yes. And actually, so CanCare has added those videos to the main page as well. So, and it walks you through exactly how to link that account and or set up the account or any kind of questions. It's there's a big series of videos that you'd be able to access. So let's see. Questions from the chat. So for, let's see, I don't know if Joyce, if you've got a microphone you can access. If not, that may be a question that we can pass along to KDHE to see if there's any specifics. Okay, no problem. Would it be okay if I just connected you with KDHE to kind of see if they can assist, since that's kind of like a one-on-one? Okay, great. Thanks, Joyce. Get that. Okay.
And I see a question from Patty, and I know Patty had her hand earlier. Questions about the question about consumer understanding and awareness of current redetermination requirements. Is outreach penetrating? I think that's a great question, Patty.
That would be, we've got insights, but I would love to hear from you all if this is something that has been on your radar, if you've seen advertisements or heard them, or where have you all heard about the Unwind would be something I'm interested in. Are you typically hearing from like the person who's panicking and received their renewal paperwork?
Yeah, I think maybe if folks have some reactions to that in the chat, you have just as much reaction. I mean, I think experience as Kate or others do as to whether or not you feel like, because in some ways as consumers or navigators and coordinators, you may have a sense of like whether or not the outreach is penetrating or not. And we might be able to chat about that based off of experience later. Given the sense of time, I think there's been a lot of good questions. Why don't we move now to Rachel? I know she has a presentation, but I also know that we have we'll have more time for question and answers after Rachel's presentation. And we'll work on responding to the questions like the fax number for the application in the chat as we go through. So continue to use the chat, and I'll turn things over to Rachel. And thank you all for being so engaged.
All right, can everybody hear me okay? Okay, perfect. So good morning. My name is Rachel Alexander, and I'm an outreach specialist with CMS, the local and engagement administration kind of umbrella of CMS. So it's a pleasure to join you today and speak a little bit about the end of the continuous enrollment condition and what that means for people enrolled in Medicaid and CHIP as we try to return to normal operations after the pandemic. So since many people enrolled in Medicaid have not had to complete a full renewal process in nearly 3 years, if ever, we want to make sure that people enrolled in Medicaid and CHIP are aware that this is coming and know what steps they need to take to keep health coverage, whether that's through Medicaid and CHIP or another health coverage option like the marketplace on healthcare.gov. So Patty, you brought up a great question, and I'd be curious to see how people are hearing about it as well, because I think right now our biggest concern is there was a recent study, I want to say it was by KFF, that was put out that said around 60% of people had no idea what this is and what's happening. So I'd be anxious to kind of keep up with you guys and hear the answers to that question as well. So right now, it is estimated that about 16 million individuals may lose Medicaid coverage despite still being eligible for coverage. So children and young adults will be impacted the most, with an estimated 5.3 million children and 4.7 million adults ages 18 to 34 predicted to lose coverage. Nearly 1/3 of those are Latino and 15% are African American. These are populations that, as you know, were highly affected by the pandemic, but experienced health disparities long before that. So knowing these predictions ahead of time, we hope that, with your help, we can do everything possible to mitigate further disparities in coverage and access to healthcare. So right now, there are really 4 main messages that partners should focus on now when communicating with people that are enrolled in Medicaid and CHIP. So 1, as you heard from Kate, is update your contact information with the state Medicaid or CHIP agency. Respond to that Medicaid and CHIP renewal form when it arrives to keep your coverage. Parents should respond even if you don't think that you're eligible yourself anymore. Your kids could still be eligible. So we still want that renewal form to be sent in. And then consider other coverage options. If you're no longer eligible for Medicaid or CHIP, check if you can get coverage through your employer, through the marketplace on healthcare.gov, or through Medicare. So CMS has created a series of resources to help partners become more informed about Medicaid unwinding and to help support partners as they reach out to their different audiences. First, there's an unwinding webpage, which can be accessed at medicaid.gov/unwinding. I put a bunch of these resources already in the chat, and I will make sure that I send a complete list to Kate in a follow-up email. So the unwinding webpage can be accessed at /unwinding. That is a centralized location where states and stakeholders like you can learn more about unwinding and access resources to help with any kind of outreach efforts. The unwinding webpage, you can also find communications toolkits, other materials under outreach and education resources, and the toolkit provides some additional context on unwinding that we hope will be helpful if you or your colleagues are kind of new to the topic of unwinding, or if you're working with people who need a basic understanding of unwinding. So you'll see my screen here, and this is the page I'm referring to with different communications toolkits and languages that are available. If there is a language you need that you don't see, please reach out to me. I can reach out to my colleagues in the Office of Communications and see if we can do any kind of translating for you. You'll also see fillable flyers that allow partners to easily create state or local resources to supplement their general messaging. We have drop-in articles, social media posts and graphics, text messages and email content, even a call center script if you're taking consumer calls, which I know a lot of you are, either through that new kind of Mac system where you're doing a little bit of cold calling with people, There's also a partner tip sheet with tips to help people that have recently lost Medicaid or CHIP coverage, and fact sheets about other health insurance coverage options for people who are no longer eligible for Medicaid or CHIP. A big piece of that will be, and you may have heard about this, but the marketplace is doing a special enrollment period, what we call an SEP, that will go through July of 2024. All somebody needs to do is in their application on healthcare.gov or their phone call to their marketplace, is tell them that you have recently lost coverage or are going to, and give them the date that's on the letter that you received. If you don't have that date, your best estimate will work. And then the system will automatically generate a special enrollment period for that individual to enroll, with coverage effective near that termination, Medicaid termination date, to prevent any kind of gap in coverage. I continue to hold kind of monthly meetings with navigators and assisters across our 4-state region, and Kate joins those and passes along any information I share. But it's nice to hear from you guys and kind of offer technical assistance, especially as we really get into people who are losing coverage and applying on healthcare.gov. I am the marketplace kind of lead for our region, and so I continue to hold those meetings monthly and can send out an invite if anybody is interested in sitting in on those and listening to what's going on the marketplace side of this as well. Let's see. So you can download any of these materials, postcards, flyers, conference cards, tip sheets. They are all like in PDF format. Let me see here if I can show you that right here. So these you can transfer to different formats and use at any time. So this is just a drop-in article for maybe your newsletters. Sorry, I'm going to scroll. I don't want to make anybody dizzy. And then social media and outreach products. So you can download and use any of these things. It's totally free. Again, if you need another language, feel free to reach out and we can see if we can get that for you. So another option is when someone is enrolled in health coverage, CMS has resources to help them understand that coverage, and use it to receive primary care and preventative services. It's called Coverage to Care Initiative, which offers different resources for consumers and partners in 9 different languages currently to help understand key terms like deductible and copay, how to find a provider who takes your coverage, and how to stay connected to care. So I will provide some of that information to Kate as well. And lastly, we do encourage everybody to attend HHS and CMS monthly Medicaid and CHIP continuous enrollment webinar series. It's the 4th Wednesday of every month at 11. And I put that link in the chat to sign up and register for those. So I think that is it from me. If anybody has questions, I know I covered that really quickly, and I can continue to kind of go through some of these different toolkits if people are interested in looking at some of that, but I'm happy to take any questions.
Thank you, Rachel. Any questions for Rachel? Rachel, could you talk a little bit about HHS's and the Secretary's commitment to offering policy flexibility to the states to make this process go as smoothly as possible?
Sure, a little bit. So there are different kind of waivers and different things in place. So Joe Palm, who is our regional director of HHS, frequently attends those webinars and things, and he, they are trying to be really flexible with states. I know that Kansas recently, what was it? Maybe you'll know about some, I'm trying to think of what it was. I was just on a CanCare meeting last Friday and they talked about it with KDADs. David, were you on that call?
I was not, sorry.
Oh, okay. well, here, I can actually pull this up right here while I'm chatting with you. So this is a letter that the secretary recently released to the governors across the country, just because of the high number of people that may lose coverage. And so the flexibilities that are in place, obviously, you know, spreading renewals over these 12 months. And then let's see, renewing individuals on the basis of their eligibility for, you know, SNAP benefits and temporary assistance that can help reduce some of that burden on families. And I can send this whole list out of these different flexibilities that we've passed, so that way you don't have to go searching for it. But I can make sure that I send some of this out. And some of it is even regarding like things like telehealth visits, just the flexibility with some of that that was not in place before COVID.
Great. Thank you, Rachel. I see that Cherie has a question.
Yes, I was just gonna say, is there a way for us to know, like when we do a renewal, like, because I did one yesterday, but like they weren't told whether they was approved for or, you know, for insurance, or, you know, I guess I'm trying to say like, depending on like they are approved for Medicaid, or not, like, and then so that I'll know, okay, I need to refer them into the marketplace. Am I making sense?
Yes, absolutely. So what typically happens on our side is that if somebody applies for Medicaid and is denied, their application is sent kind of in the background to the marketplace. And so the consumer should receive a letter that says, you know, no, we cannot approve you at this time, or, you know, whatever specific language. And then you can take that letter and then sign up, go to healthcare.gov, start a new application. And then there's a question specifically on there. Have you recently been denied or lost Medicaid coverage? The answer to that is yes. You'd provide that date of the denial on the letter, and it automatically generates the special enrollment period for that individual to sign up on healthcare.gov.
And so how long does it typically take for them to know if they are renewed or not? So I understand like the PEs and stuff, presumptive eligibility, that is an immediate, you know, no answer. But on the renewals, how long does it usually take for them to know that?
That's a good question. And that may be better for Kate. I'm not sure how long that process takes.
Yeah, I think it's dependent, you know, each state does things differently. So that's something we can find out through KDHE, unless Russell's able to answer that.
Sure. There probably really isn't a good answer to it, because when we receive the person's review form, if we've received it timely, they're going to just stay eligible until we process it. And I don't believe we have really good enough data to tell you how long it's taking us to process reviews right now. I would hope that would somewhere be between 30 to 45 days. But as long as we've got their review, they will continue to be eligible until we process it to come out with a new eligibility or a denial, and they'll get their notice at that time.
So you're saying if they're within that time frame deadline of not being like canceled, if they're within that, they'll still have coverage until it's determined, everything's determined? Or like, so for instance, with me, I had a consumer who came in late. Theirs was canceled. They didn't have any insurance. And so we went ahead and just did a new application on them. And so it didn't say anything. It just gave them information stating that they did receive it though. So
And
is
are
that
you
what you're
talking?
saying?
Yep, and when you say you help them fill out something, are you saying that you help them fill out for Kansas Medicaid, or for the market?
Uh-huh,
Okay,
for Medicaid.
so
Mhm.
if they had already been closed, that, and you filled out an application, that might be looked at as an application, and they try to do those within 45 days.
Okay, okay. All right, thank
And
you.
if that
But,
person-
but are they still, do they still have insurance?
No.
So they won't have insurance, okay.
Once they get a letter that says your case is closed because you didn't turn it in, or your case is closed because you're over the income limit, that's when their coverage ends, the date on that letter. So if they
Okay.
send in a review form and they hear nothing, that means that they are still eligible. And when something changes, they will get a letter when that happens.
Okay, thank you.
And so Sheree, just so you know, with folks who did receive that coverage end notice, if they have their renewal paperwork and just weren't able to send it in on time, sending in that renewal paperwork will kind of it'll kind of speed up the process a little bit rather than sending in a new application. So just for future reference, they would be able to kind of send in that renewal form, and if they're approved that way, then they may be able to get backdated coverage because they have 90 days from like that closing date to be able to get their renewal paperwork in to get backdated coverage. But at the time, they're not insured, but any kind of expenses that they have may be able to get reimbursed once if they're found eligible again. Does that make some sense?
Yes, but I'm also fine. I'm getting a lot of consumers who don't even have that paperwork. They just go either to get prescriptions, or they go to the doctor or something, and they find out they don't have any insurance. And so, and that's why one of the first questions I asked them, did you get any paperwork on this? And of course they say no. And so I'm just having to kind of either call clearinghouse. I'm, just having to find other avenues of ways to find out, like, what's the status and all that. So, yeah.
So the good news is that you're calling the right place, the clearinghouse. And I would suggest, if they can find the review form, to go ahead and send that in, because it's going to be automatically recognized as a review form, and it has a barcode on it that makes it much easier to go through the process. And the 3 months following the closure is still a window to turn in that review form, but you can substitute an application, but it's going to go through the system smoother if you use the review form.
So, just to follow up that, so if someone loses coverage theoretically because they didn't get the mail because their address wasn't updated, would it be more advantageous for them to go then and would you update the address, and then would they then send the renewal paperwork even though they were churned off? Like, how would they get that if they'd never had it? Because
So if they never had it and they call the clearinghouse and the clearinghouse says, you closed in April because we didn't get your review form, they can update their address at that moment on the phone with the clearinghouse, and the clearinghouse will also then remail the review form to them.
Perfect. And then it's better to fill that out than to start a new application.
Either will work, but the review process is going to go smoother if you use a review form.
Yep.
So I would suggest using a review form.
Or if you do it online. We've noticed that that's been helpful as well, because it's faster.
Yeah, and this was a detail from earlier in the call. I think we sort of maybe led people to believe that they were only getting the review form by mail, and that's somewhat true. Everybody is going to get a review form in the mail, but if you have an online account set up, you will also have a review form with your online account. So you'll get both. You'll get one in your online account, one in your paper. You don't have to send in both. Whichever one works for you, the better.
I'm finding that a lot of my people don't even have this, they don't do the portal thing. And so just trying to get them comfortable with that. So that won't even be up there unless they've already previously had it, correct?
That would be correct. I think that's earlier, they said it's better if you set up your account prior to going into your review month. That makes it easier. That's sort of what they were talking about. If you sort of wait until you're behind the 8 ball there, it's not going to work as smoothly.
Excellent. Thank you, Russell. Any other last questions? We're butting
I
up.
have a quick comment
Yes,
of
thank you,
things that
Laura.
we have seen that might cause a little delay, confusion, unnecessary work for the clearinghouse, and confusion for the member. Sometimes members go and create an account online and then reapply, and that is valid too. It eventually get processed, but again, is more lengthy and unnecessary. So it's important to make the distinction. There's a step, right? So once they create an account, they also have to link the account to their case. If they do that, it takes a few days, a couple of days, but once it is linked, then they can see when is the renewal date and if that renewal form is available, and then they can complete that one, which is shorter and it goes faster, just as is with paper. So creating the account in the portal is not enough. They also have to link the account to their case number, and that case number can be found on the form. But if they didn't receive the form or don't have it, they can of course call the clearinghouse to get that case number, or they can call their MCOs to get that case number. And then they enter that in the link. It's pretty self-explanatory, it's easy to navigate. And a couple of days later, that account gets linked to the case, and now they can do the renewal that way, which is still faster than calling, requesting the form, waiting the mail, filling it out, sending it back. So it is a good option.
Excellent. Thank you for that, that tip and insight. Well, thank you all for joining. If there's additional questions, feel free to email Kate directly or email us. We can pass them along. We also can compile questions for the next webinar, which will be held in 2 weeks, and we'll really get into more detail on some of these tips and tricks, as well as other hands-on advice. And we'd love to hear from you about questions you want answered and topics to cover. Thank you again for joining us, and we look forward to seeing you on the 26th at 11 a.m. Have a great day, and we will talk soon. Take care. And thank you again to our presenters.